Hello friends, I am Dr. Bhavna Banga. I am the Clinical Director and the Unit Head for Cloud9 Group of Hospitals, Kailash Colony. So we need to understand what are the hazardous effects of a varicocele. Varicocele is a clinical situation where the veins around the scrotum are swollen or inflamed. Due to this, there is increase in the scrotal temperature. Because with every degree rise in the scrotal temperature, it can damage the DNA of the sperm. It can induce excessive oxidative stress into the sperm environment, and all these lead to suboptimal reproductive outcomes. Hence, once we do the microsurgical varicocele repair, it is very important to understand that the varicocele repair can be done with an open technique, it can be done through laparoscopy, and it can be done through a microsurgical route. The best process is through the microsurgical route because that reduces the chance to damage to the testes, it will safeguard the lymphatics, and it will decrease the chance of post-operative hydrocele, and it will optimize the sperm count, motility and morphology.